We're just coming in with a 21-year-old male, GCS 15 from the corrections center here. Just a TPA. He's got multiple puncture wounds, one of the larger ones. And he's got 3 to his head. They're around 1 inch in diameter, and then 1 to his back, and upper back, and 4 to his upper chest. Those are all about a centimeter in diameter, just kind of full of blood. And then multiple other smaller wounds, with the bleeding controlled kind of on his right arm, and to his ear. Vitals, blood pressure was 114 on 63, heart rate 75, standing at 99% on room air. He's comfortable right now, he's just talking with us. We do have an IV established, we'll be there in about 10 minutes.
Evening, General. We're en route with a 3-year-old male, conscious and alert, coming from the Pasqua, just to transfer ER to ER, showing signs of sepsis. We have ceftriaxone running, and D5 vitally. He's stable. We'll be there in about 5 minutes. Hey, General, I'm out to you with a conscious alert, 17-year-old female. Complaints of productive cough, fever, and chills, feeling unwell since May 9th. Developed some chest pain about 2 days ago. Progressing since then. ECG's been remarkable. She's a sinus rhythm. Vitals are all stable. We'll be there in about 5.
Hey, General, I've got a crew coming in from about 8 minutes out with a now intubated, exacerbated COPD patient, 65-year-old female. Last pressure, she was hypertensive at 168. Crew will probably update en route. We'll need RT in a room.
Hey, General, we're up to you with your MFI. Unfortunately, 65-year-old female. COPD exacerbation today. Woke up this morning feeling close to breath. When we arrived, stats were 90% on room air. Quite trypnic, so we did start with a 5 and 500 Neb. With no relief. Once we put her on CPAP, she became quite obtunded. She came down to about a GCS of about 5 at that time. We have intubated her using ketamine and fentanyl for induction. She is successfully intubated. We have some polymental running right now. Stats right now are 90% with the BVM. Hypertensive right now at 180 on 100. And vitals been high the whole time, currently 92. Totally been remarkable. She's just in a sinus attack right now at 110. Otherwise, stable right now. We'll be there in about 6 minutes.
Hey, General, we're coming to you with a 19-year-old conscious and alert female. Coming from the university, had a cooking accident, has about a 1-inch laceration on her finger, not currently bleeding or anything like that. Vitals are currently stable with you about 5 minutes.
Hello, Pasqua, now to you with a conscious alert, 46-year-old male. From McDonald's today, E2H++, complaints of back pain and leg pain bilaterally. Was at your facility earlier today? Vitals are stable, we'll be there in 5.
Afternoon, Pasqua. Coming in with a 84-year-old conscious male, has had an onset of lower quadrant abdominal pain, and are coming from a care home. Has a catheter in place, and around 7:30 this morning, had staff do rounds. Supposed notice that his catheter bag hasn't been filling up since this afternoon. Patient has also had an onset of lower quadrant pain. We suspect there would be some sort of bypass in the catheter. Other than that, vitals are stable. Tap at 36.4. Patient does deny taking some Tylenol for the pain. We'll be there in about 6 minutes.
Hey there, Pasqua, coming out with a 42-year-old constant female patient complaining of shortness of breath. Progressively worsening throughout the evening today. Tried MDI with no relief. On arrival, audible wheezing noted. Setting at 92% with inspiratory, expiratory wheezing throughout. History of lung cancer and also a recent lung infection. So far with us, 10 milligrams of insulin through a neb, as well as 500 mics of atropine. No changes to those lung sounds, so these are remarkable. Sinus attack on the monitor. ILA positive, unable to establish peripheral access, and we should see in about 5 or so minutes.
Good morning. My name is conscious alert 77 female. She complains shortness of breath. Woke up from bed this morning unable to catch her breath. Initial room air stats 56%. Now 99% on nebulizer with 5 and 500 of ventilated aspirin. Also receiving solely Medrol at this point. Current vitals, heart rate's 110. Antennas 44, rest rate's 28. Blood pressure is 144 on 71. We have an IV established, we'll be there in about 5-10 minutes.
We are en route within alert and oriented 31-year-old female, complaining of 9 out of 10 pelvic pain. We've also had some nausea and vomiting since last night with a little bit of spotting of blood. Vitals are stable, and we will see you in 3 minutes.